Hello, welcome to Healthy Hearing Loss. My name is Dee Dee. I have not been on this channel for probably over a year now, I would say, and I apologize. I've been quite busy, have a very hectic schedule. Even though I am back today to post a video, I won't be posting as frequently as I was before, only because of my kind of crazy lifestyle right now. But I will pop on here from time to time to share anything new that I am trying out or anything I've learned so that I can share it with you. Now, at the beginning of my healthcare journey, I was very frustrated that there wasn't any information on how to use stethoscopes when you have hearing loss. Now, I have a line of stethoscopes that I use and I've tried over the years, and I really try my best to share my experience with others so that they can create their own setup from the knowledge that they gained through this channel. And what I mean by setup is any technologies that you use in combination that helps you do a certain task. Like, for an example, using a stethoscope. How do you hear best through a stethoscope? Like, I use an iPhone and my hearing aids and a stethoscope, and they link them all together, and it helps me to hear the best that I can. We're going to be talking about the Littmann Core 500, which is a very similar setup as my previous stethoscope, which was the 3M Littmann Core. So this is the Core 500, and this is the 3M Littmann Core. So to keep it simple, this I'm going to refer to as the Core 500, appropriate, right? And this one I'm just going to refer to as Little Core. Now, I'm not talking about the size specifically when I'm comparing the two, but I am talking more about performance. Right now, the Core 500 is on the top of my list as far as performance go. But they also do different things. If I didn't have this guy, this would be perfectly fine. I've been using it for several years and I still enjoy it a lot. So we're just going to stick with this guy, but you may hear me refer to the Little Core here and there. But I will say that when I initially got the Core 500, I left it at the clinic. So I primarily used it in the clinic. But, when I went out into the community to do outreach or street medicine, I used a Little Core. But over time, I have found that this has gone to the wayside a little bit, and this has become my primary in and out of the clinic. So I usually use this one most of the time. And of course, as you can tell, I'm not doing an unboxing, because if you were to purchase this thing, I want you to find the excitement of unboxing it yourself. You don't need me to show you that. Before I dive into all the features and the little details about the Core 500, I think that there's something that I have been missing out on my videos, and it's an important thought that I'd like to share. And we live in a very fast-paced world. I think that one of the things that I found most beneficial to help me hear through a stethoscope is, and it could be applied to the rest of your life too, is breathe. We move so much, we think so much, we do so much, and sometimes we forget to slow down and breathe. And I think that that is one of the things, the key element of listening to a stethoscope that I haven't forgotten to share that's been so beneficial is when you are focused and concentrating, and you can really listen very effectively through the stethoscope. If you are running fast, moving around from one patient to the next, of course that's the work we do, but there is that moment in time where you can just take a breath and just listen without being distracted. If you were to take this to a neurobiology level, you would be thinking about stress and anxiety. When you have those heightened, you cannot think, focus, and concentrate as much as you would like. So reducing your stress and anxiety can be greatly reduced with breathing exercises, specifically a longer exhale. So, that's a sigh breath. If you ever watch any of Andrew Huberman Lab podcast, he talks about the physiological sigh, which is really something. It's a point in time breathing exercise that you can do. You owe it to yourself. you know? And plus, if you have a lot of stress and anxiety, you know that increased heart rate and blood pressure is not good. And the best way to lower that is to slow down and breathe. Now we're going to get into the Core 500 stuff. The Littman Core 500 stethoscope is a premium diagnostic tool designed for healthcare professionals, particularly nurses and physicians, to assess and monitor patients' cardiovascular and respiratory health effectively. This is coming right from the Eko website. You can go check it out if you want to. I'll cite that in someplace. Now, the Core 500 is a very sophisticated stethoscope. It has a lot of very cool things that it can do, has a lot of features, but it has a lot of technology that I don't want to cover too much here. I'm just going to tap into them a little bit, just because I want to be able to back up why I believe that the cost of the stethoscope between $400 to $430 in US as of today is appropriate. Because if you think about everything that went into this stethoscope, it's unbelievable. And one of the other things I wanted to share is that I did get my name engraved on the side, which is really cool, because that means it's mine. I just got an email today, a matter of fact, that says if you use this promo code, you can get the engraving free. Why does it cost so much? Well, first thing, it is a pretty beautiful stethoscope when you look at it and you feel the weight of it. You can tell that a lot went into this, and it's very high tech. You can get it in matted black, or you can get it in silver color. And again, you already know about getting the engraving in there. I'm going to look at their website and take something right from the website. It is the first digital stethoscope with high fidelity audio, a full color display, and a 3-lead EKG. It has advanced true sound technology, which is the next generation of audio quality, and it provides the most precise sound. On top of that, it's supported by the Eko FDA cleared AI, artificial intelligence. Can it see me? Kidding. The stethoscope flags abnormalities such as murmurs and AFibs in seconds, right at the point of care. Pretty impressive. With the advanced audio features such as amplification, it's about 40 times amplification, noise cancellation, fine-tuned filters, the Core 500 offers the ultimate audio experience to improve detection and confidence clinical decision making. And I will contest to that. It absolutely does. But first off, let's look at each one of these. The first thing I want to break down is, what is high fidelity audio? Well, it really just refers to the high quality reproduction of sound, and it minimizes distortion in sound or loss of fidelity, resulting in a faithful and accurate representation of the sound. Full color display is also known as the color display, or RGB, and it's creating an engaging, immersive visual experience. You'll see it as I start to tell you more about the Core 500. The 3-lead EKG. One side of the face has 3 leads. Now, I'm going to be posting a picture at the same time, but we have lead number 1, and I will use it in this way so that you can actually use this to help you remember what lead 1, 2, and 3 is. But lead 1 goes from the right arm across the body to the left arm, and so it gets that view of the heart. So you can think of this lead talking to this lead, okay? And then we have, that's lead 1, and lead 2 goes to the right arm towards the left leg. So it goes across the body, so it's getting the angle in this direction, right? You go to the left upper to the left lower leg, that's lead 3. So you have 1, 2, 3. So I showed those pictures there so that you can see what those are. But you can see the direction that it's getting from your heart. And it gives you a 3-lead EKG. Pretty cool. Now, even though it's only limited to 3 and it's not quite as much or as sophisticated as a 12-lead, it is portable. I can take it wherever I want. I don't have to rush back to the office to do an EKG. So I can plop it right on somebody's chest and get at least 3 leads. It's right on point of care. So as we mentioned, you can do it quickly to assess patients' suspected cardiac disease issues or during just regular routine procedures. It's easy to set up and provides essential information about the heart electrical function in any setting. It says clinical setting, any setting. I do it on the street, under a bridge, in somebody's home. I take it everywhere. So even those are not clinical settings, but specifically they said clinical setting, but you can do it just about anywhere. But I do want to make sure that we highlight some of the biggest features of it, which I've already mentioned a couple here: sound filtering, background noise reduction, minimizes artifact so that you can hear the softest heart and lung sounds while auscultating. It does high quality audio delivery to the headphones or speakers, to hearing aids. It has 3 filters, and you would see it when you press on the button. It has the cardiac filter, it has a pulmonary filter, and wide sounds. So I generally use the wide for when I'm taking the blood pressure. I do the cardiac when I'm listening to the heart, and I use the pulmonary when I'm listening to the lungs. So it's essentially just like whether you want to go to the bell or the diaphragm to get deeper or high sounds. That's basically what that is, and it works really, really nice. It has obviously Bluetooth wireless listening options, telehealth compatible, which I don't use because I don't have a subscription, and it records and saves on the Eko app on your phone, which can then be shared. I have saved some there, and I've shared them by showing people, but I have not transferred them into the electronic health records. And that's not something I'm doing right now. Now, since this channel is specifically for people with hearing loss, I got rid of the boring stuff first. Probably should have done it at the end of the video, but let's get into what is good for us with hearing loss. Okie dokie, and this is both for students and working clinicians. It has up to 40 times sound amplification with 7 volume levels, increasing confidence in what you're hearing. So tap that on to noise reduction, sound filtering, all of that, and you add all of this, it becomes pretty nice. Sound amplification helps user hear lower frequency sounds more clearly. I'm not an audiologist, nor am I a cardiologist. I work as a nurse practitioner in a primary care setting, so I have a lot of information in this brain of mine. All right, let's get back into this, the waveform visualization, the phonocardiogram and the electrocardiogram. So you know how the S1 and S2, the phonocardiogram is what you can hear between 2 beats, and then the electrocardiogram is the actual tracing of the electrical heart, but you can see a nice rhythm. The Eko app helps confirm the sounds heard and electrical signals seen. So that's the beauty about this, is that you can not only hear it, but you can see it. You can see it on this actual stethoscope, but you can also see it on the Eko app. So it's almost like a 3-way way of confirming. I don't usually use this too much because I pay attention to the phone a lot. Active noise cancellation. So like if you're in a busy environment, it kind of breaks down the background noise so you can hear the sounds better, which is so needed. And it's really good for providers that work on an ambulance, or if you have a baby crying, any of that, it kind of drowns that out so you can hear the sound that you're putting the stethoscope on. Hopefully it's a person. You can use it on a dog or a cat, veterinarians. That's what they say. It can be used with wireless listening devices such as hearing aids, stethoscope, phone. This is my setup. The beauty of this is that the sound goes through the stethoscope, connects to the iPhone, and connects through my program of my hearing aids. So that's really, 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 really important. Another thing to mention, going back to why I find it beneficial to slow down and take a breath, it takes longer for us to hear sounds than somebody who has normal hearing. So just keep that in mind. Give yourself a little bit more time to be able to let things process. It's a great time to take a time out. Self-care, baby. So it does have the earpiece that we have been looking at. Little earpieces here. I let one of my nurses use it the other day, and she used it like a traditional stethoscope, except it's digital, so she heard it very loud. So you don't actually need it with the Eko app itself, but you wouldn't get the full features of the Eko app if you didn't pair it, like seeing the EKG, although you see it on here. It's totally up to you, but I would say go with the Eko app. I didn't know that you can use your HSA account with this. I didn't know you can use your work reimbursement with this, but you can. So be sure to talk to your employee if you want to buy one of these. There is a automatic power off button. I think I have mine set for 2 minutes. So if I use it, I put it around my neck, it shuts off in 2 minutes. It has a USB-C charging port right here, and then you can charge that. Charges really good. It has about 60 hours of clinical use. And I read on the website somewhere that said clinicians reported seeing an average of 92 patients with the Core 500 on one full charge. I believe it. I've had this for several months, and I'm telling you, I probably charged it 1-2 times. It's crazy. It has a lithium battery, so that's really good. It stays charged for a long time. One of the other things it mentioned on the website is that it is not fully waterproof. I would say that it might be water resistant. It keeps dust out, it keeps sweat out, and you can clean it with an alcohol pad, 70% alcohol, but you don't want to submerge it in any kind of liquid that you're using, and you don't want to put it in the autoclave. I thought that was pretty funny. You don't want to put it in a sterilization process. It is FDA approved. Bingo. It's recommended for physicians, nurse practitioners, physician assistants, nurses, EMTs, first responders, respiratory therapists, home health providers, etc., etc. That's all of them. All right, let's get into the pros and cons of this. The pros is $430. I find that a pro. And now some people aren't going to be able to afford that. But if you do have some kind of reimbursement or HSA account or something, use that to help you. I don't know if maybe some people can get some grants or maybe donation somewhere. I don't know. But it's worth the $430 for all the technology that it provides for us to be able to hear the sounds to the best of our ability, especially with hearing loss. The combination of the high-tech hearing aids, high-tech stethoscope, high-tech phones, you cannot beat this. You're going to hear this really very well. I have profound hearing loss, and I'm able to hear sounds very well. As long as I slow down, place the stethoscope right on the skin. I can hear sometimes over the clothes, but it's very rare that I would do that. But there are times I have to. If I'm outside and in the street, I have to go over the clothes. I prefer not to. On the skin itself, slow down. If you're rushing and you're shaking because you're in fight or flight, it isn't going to work. It's going to have a lot of artifact. So slow down, place it on the skin, and you got it. It's a wonderful thing. Pause, breathe, and focus. It works. And when you think about comparing a wearable, you know, with the ones that you like, our Apple Watch or some sort of heart rate tracking or whatever, like the Apple Watch is, I think it's like $200 or something, right? So there's some high, tech devices out there that just do those minimal things with the little apps on there. Whereas this thing does so much more, and it's part of your job, and it's a good diagnostic tool. Now, it doesn't necessarily, if you were to think about tachycardia, I can diagnose tachycardia, afibrillation with this. Yes, I can hear murmurs and I can hear some irregularity, but there are going to be times when you need an extra diagnostic test or sending them to a specialist. Now we're getting into the cons. The first thing I will say, when I first bought this thing, the head is very heavy. So it just started kind of slipping off to the side. So I had to keep pulling on it to get it back there. Well, that's all right. So I went ahead and started to put it through the earpiece here and let it rest there. Initially, when I first got this thing, it was driving me crazy. I had it was out like this. It just would not. It would always stay out like this, and it catches on everything, and it drove me crazy. So eventually, I was able to work its way over here, and it molded to my chest. So now that the earpiece are in, and it doesn't get caught in anything. So that's one of the things. So I just slip it like this. It's not as good as the little core, but that's what it is. Sorry if I hit the mic. Another con is sometimes, I wouldn't say this is a very big con, but the other con is that my hearing aids is always searching for Bluetooth devices. I can connect up to 8 devices with these hearing aids, and these are the Phonic Adeo. That's what I use. And if I'm not using this, it's searching for some sort of Bluetooth to connect to. And so sometimes when I go to reuse this and connect again, it doesn't connect automatically. I have to push a button on the Eko app, which is one button, connect, and you got it, right? Very simple. But other times it connects. I just turn it on and it's connected to my phone, and it automatically starts to record, because that's how I have it programmed. And voila, it tells me it has a murmur, or it's tachycardia, or it's normal, there's no abnormalities, etc., etc. This is probably one of the best inventions I've ever seen when it comes to stethoscopes and making my work a lot easier. There's no other cons. Unless you really think that the price is really too much, then maybe that's a con to you. But for all the stuff that it can do, I think it's a pretty good price. I left my stethoscope at work, and the physician assistant, who already uses the little core, started using this stethoscope for a couple of weeks, and now he's going to buy it. We have another nurse practitioner at our workplace that also has this, loves it. And both of them, the PA and the NP, have normal hearing. And so that goes to tell you something, like even even people with hearing or hearing loss are finding this stethoscope to be really awesome and one of the best inventions, especially if you do any outreach or home visits or street medicine, or you're running around in the hospital and you have a place to always be. You can just do this quickly and it's fantastic. I would show you more with the Eko app, but my phone is where you are. I'm recording using my phone today, so I can't do that. But I will try to do some screenshots and throw them up here. Or maybe I've already done it with the whole video. Core 500. If you choose to buy it, get it engraved. If you choose to buy it, record yourself using it, share it with other people, tell them how great it is and how easy it's making your life. I use this along with a POCUS, point of care ultrasound. It's fabulous. All right, so we've covered a lot on this. It's really, some of it was boring, some of it was necessary, but please, whatever you do, slow down, take care of yourself, breathe, just take care of yourself, especially if you're in nursing school or medical school. Take care of yourself. Take care.